So if you're wearing a denture or you can't save a person's teeth, they need a full mouth of extractions, in your office, what are the options when it comes to dental implants?
Okay, so the first thing is if we have a patient that we deem they're going to lose all their teeth.
Okay.
They're edentulous now. We have different levels of what we can do for them. Most of the levels are based on two things: amount of bone, how much bone the patient has, and how much the patient wants to go through. So we start with the basics. Implants are great for retention. So we retain a prosthesis. That sounds very technical. We take your denture and we hold it with implants, and so it doesn't
like
come
a snap
off.
in.
Yeah, like buttons on your denim jacket. The denture clicks in, and it holds while you chew, while you function, but it still comes off. It still gets food underneath. You got to take it off, clean it, put it back on. Super comfortable. It's a huge step up for the people or the person that was in dentures with nothing holding it. Huge step up. No more denture adhesive, which we hate. That's our first level. Our second level is a little bit more retention. So if I place 2 implants, picture this as a pivot. Your denture's going to rock.
Okay.
It'll still rock a little bit. It'll still have some movement. So if we put 3, now I have a tripod. It won't rock. A little bit more comfortable, but still, again, I have on the top a full palate coverage. On the bottom, flanges or what goes down into your cheeks, and it'll get food underneath. It still has to come out.
We're talking about snap in, snap out.
Still snap in, snap out. Yeah, with 3 implants. But then I tell my patients, hey, what if we do a little bit more, and instead of having something that comes in and out and sleeps in a cup and gets food underneath, how about we do something that stays in your mouth all the time, only I can take it off when you come in for your follow-ups once every 6 months or once a year, or how about that? What is that?
Well, of course they're going to say yes, right?
They love it. They love it. The difference in prices are actually not that much. So why not go that route?
And they can eat whatever they want with these teeth.
Anything. They can eat anything. They can have a totally normal life. I actually tell my patients, if I'm doing something for you, I'm expecting you to have a normal life. I want you to have a normal life. I want you to live your life. Don't limit it.
So chewy things? I mean, could they eat chewy things?
Yes.
Like pizza?
Of course. Of course.
What about like a carrot with their front teeth?
Go ahead.
So these fixed teeth are strong.
These fixed teeth are very strong. Very strong.
How old can you be to get this done?
Well, I once treated a guy who was 102 years old.
102?
Yeah, several years back. He was on a cruise with his girlfriend, and he had an embarrassing moment with his girlfriend, 102.
Okay.
He had an embarrassing moment because his denture broke, and he came to us saying, I will never, whatever I live, 1 more month, 1 more year, 10 more years, I don't know, but whatever I live, I want to have teeth that stay in my mouth that don't embarrass me. How old can you be, or how old? Any age.
It does seem painful. Is it painful? I mean, if everything goes right, what's the downtime like?
Okay, so obviously during the procedure, you're not going to feel a thing. We have different levels of sedation. You're going to be completely numb. You won't feel a thing. So during the procedure, no pain. And then after the procedure, I'm gonna tell you like tiers of patients. I'm gonna tell you probably 20% of my patients feel what I say is abnormal, no pain.
Okay.
0. And it's like, oh my God, I was expecting you. And I always give them obviously pain medication and follow up and hey, how are you doing? And then I'm going to tell you the big spread. 70% of my patients have what we call the norm. 3 days of pain or discomfort in a 1 to 10 scale.
Like a little sore.
A little, yeah, some discomfort for 3 days, and then it starts tapering down.
Okay.
And then there's obviously the people that, it wasn't as easy. But it's a very small minority. And 100% of the times, when the pain goes away, the discomfort goes away, people start feeling that this is mine, this feels natural, this feels comfortable, my life is back.
So no more dentures?
No more dentures.
You think you wipe out dentures in Texas?
I wish.
I mean, if these denture wearers knew how good it was, there's probably not even enough dentists to help them.
This is funny. So we call it in dentistry, we call it the standard of care. And the standard of care is substandard. A denture is substandard. A denture is dehumanizing. A denture is uncomfortable. It's dirty. It's substandard.
So replace that.
Yes,
with dental
everybody
implants.
should.
Full set of teeth.
I wish we could.
How soon can they eat if everything works out?
They have to eat the same day. If not, they're going to die of starvation.
Okay.
So they
eat right away.
Yes, they eat right away. Obviously, we give him some post-op instructions and
Like a softer diet at the beginning.
Yeah, start with a softer diet, but within 4 weeks they're eating almost anything.